Good afternoon, and welcome to the December 17th Community Update. My name is Stacie Wood, and I'm a Public Information Officer here with Buncombe County Health and Human Services. Today's presenters include Stacie Saunders, Buncombe County Public Health Director, Dr. Jennifer Mullendore, Buncombe County Medical Director, Dr. Bill Hathaway, Chief Medical Officer, HCA Healthcare of North Carolina Division, and Fletcher Tove, Public Health Preparedness Director here in Buncombe County. Before we get started, I just wanted to remind you that you can find the Spanish language version of this community update on Facebook on the Buncombe County Health and Human Services page, and that can be found on Facebook at BCHHS. And we'll go ahead and get started with Stacie Saunders.
Good afternoon, neighbors. The last week has been met with highs and lows as we have rejoiced over the news of a COVID-19 vaccine making its way to North Carolina and lamented the rising cases of COVID-19 in our community. We as a nation have surpassed 17 million cases since the pandemic began. We have lost over 309,000 Americans related to COVID-19. In recent days, we are losing over 3,000 Americans each day. I know sometimes those numbers, they can make us a little numb. Each of these deaths is a person who lived in this world with us, had people who cared for them, maybe even walked their dog every day before they got sick. They are you, they are me, they are mothers and fathers, sisters and brothers, sons and daughters, friends and neighbors, and our co-workers. They are us. Over 6,000 North Carolinians have died related to COVID-19. In our own community, we have lost 138 of our own neighbors related to COVID-19. Our state has reached almost 458,000 identified cases of COVID-19 cumulatively, and we are adding about 6,000 new cases on average in the last few days to that total. In Buncombe, our percent positivity is 7.8%, and we now have a total of 7,359 cases of COVID-19 identified since the pandemic start. About a week after Thanksgiving, we began to see our cases increase. Now, well into the post-Thanksgiving surge, each day we are adding about 100 new cases. This is an incredibly difficult workload for our nurses, our contact tracers, and our support staff who have been dedicated to case investigation since March, continuing to put in those long hours to help protect you and me and our whole community. Testing in our community has also increased since the Thanksgiving holiday. Prior to Thanksgiving, we were seeing an average of 6,400 tests completed each week. Now we are well over 8,000 tests completed each week. People are presenting with symptoms consistent with COVID-19 and or a known exposure to a positive individual. Our local hospitals have seen an increase in the daily inpatient numbers associated with COVID-19, and our partners are here today from Mission to talk about that. Increasing trends statewide and locally are unsettling. There is time to turn these trends around without further restrictions. We have the tools to reduce the spread now, but it depends on not just some of us doing it, but all of us doing it. We truly hope that our community will take our advice as we head into the holidays next week. Celebrate the holidays only with those in your household. We do not recommend that you travel to a family get-together, not even just down the road. We are urging you to celebrate the upcoming holiday with those in your household only. We saw with Thanksgiving that family gatherings outside the household contributed to a surge of cases we are now experiencing. Limit physical contact with people who do not live with you. We are encouraging you to try different ways to express your fellowship and joy with friends and families instead of traditional gatherings. Though it may be different than past holidays, we live in a time when technology can be a tool to safely bring us together. Consider hosting a virtual gathering with friends and family. Swap family recipes and deliver them to the doorsteps of those in your family who are at risk for severe illness. Or consider hosting a virtual contest or a ride-by for best decorated house with family members. If you choose to travel or get together this holiday, please take our advice and learn from the lessons of Thanksgiving. Get tested before you travel. Even if your test is negative, keep your gathering small. Keep it outside if possible. Wear a mask at your gathering, even if you are family. Keep 6 feet apart and wash your hands often. There is science that tells us that wearing a mask can reduce your risk by 77%. Keeping 6 feet apart can reduce your risk by 85%. And washing our hands often can reduce our risk by 70%. These simple things can make a big impact. And when we do them together, they are a superpower of prevention. I know that I am asking you to change the way you celebrate the holidays. This is hard. I understand the desire to see family and friends more than you know. I have spent Christmas with my granny every year since I was born. She raised me since the day I took my very first breath in this world. And we have been together every Christmas of my life, except this one. She is too precious to me to risk her health and her safety. She misses seeing my children, and my children miss her immensely too. But they know that the holidays must look different so that we can keep her safe, keep ourselves safe, and keep our community safe. This is the gift we are giving each other. It is the gift that I am asking you to give each other. Speaking of gifts, vaccine is on the way. Dr. Jennifer Mullendore will be talking more about vaccines shortly. But even with vaccine, it will take time to distribute immunizations throughout our community. Until then, we have to give each other the gift of health and safety. Consider your neighbors, your family, and your own health. In this season of giving, give each other health. Wear a mask, wait 6 feet apart, and wash your hands. Stay within your household for the holidays to slow the spread. We can turn our trends around, but it depends on you and me, all of us, working together. And now, Dr. Jennifer Mullendore, our medical director at Buncombe County Health and Human Services, will join us to provide some information about COVID-19 vaccine.
Good afternoon. In the past, terrifying outbreaks of infectious diseases like smallpox and polio came to a much welcomed end when people around the world pulled together and got vaccinated. Now, we can see the way out of this global pandemic nightmare with the addition of tested, safe, and effective COVID-19 vaccines to the public health measures we are all so familiar with now, the 3 Ws. This combination of tried and true scientifically proven methods for preventing illness will help us defeat this virus, get back in control of our lives, and back to the people and places we love. Currently, there are 2 vaccines that have been shown to be highly protective against COVID-19 illness, including severe illness. One, a Pfizer Biantec vaccine was approved or authorized for use last week, and we are expecting to hear that Moderna's vaccine will receive authorization today. Scientists had a head start in creating these vaccines. They were built upon years of work in developing vaccines for similar viruses. No shortcuts were made in the development of these vaccines. It was through decades of scientific advancement and massive cooperation of the best minds in vaccine science from all over the world that we now have one and soon two vaccines that can protect us from getting sick with COVID-19. For these vaccines to be effective in moving us toward the end of the pandemic, we need people to get vaccinated. But we must acknowledge the justifiable hesitancy about the vaccine that exists in some members of our community as a result of a history of experimentation and abuse perpetrated by public health and medical providers on Black, Indigenous, and people of color in this country and around the world. One of the guiding principles of the state of North Carolina during their planning for vaccine distribution has been including the input and expertise of leaders from historically marginalized communities. Like them, we in Buncombe County remain committed to working with communities of color to understand and address their concerns related to the vaccine. Between both the Pfizer and Moderna vaccines, the number of people of color who participated in the clinical trials is notable. These studies have found that the vaccines are just as effective in people of color as they are in the white population. More than 70,000 people participated in the clinical trials for these two vaccines to see if they're safe and effective. The vaccines were nearly 95% effective in preventing COVID-19 illness, including severe illness, with no safety concerns. Like with other vaccines, there's a lot of misinformation on social media and spreading through word of mouth about these COVID vaccines. Let me be clear. You will not get COVID from these vaccines, and your DNA will not be altered by these vaccines. These mRNA vaccines do not contain the virus that causes COVID. They work by giving instructions to your cells to make a harmless piece of a protein that is found on the surface of the virus that causes COVID. After the protein piece is made by our cell, the cell breaks down the instructions and gets rid of them. The protein piece moves to the surface of the cell, and our immune system recognizes that the protein doesn't belong there and begins mounting an immune response by making antibodies against this protein. This is just like what happens naturally when someone gets infected with COVID-19. After getting vaccinated, if we were to come into contact with the virus, our bodies would be prepared to fight it off. The benefit of these vaccines, like all vaccines, is that those vaccinated gain the protection without ever having to risk the serious consequences of getting sick with COVID-19. Comparisons, again, have been made in recent weeks between the severity of COVID-19 and the flu in an effort to downplay the severity of COVID-19. COVID-19 is not just a bad flu. While hundreds of thousands of people worldwide die from the flu each year, there have been over 1.5 million COVID-related deaths reported worldwide to date. Back to what is true about the vaccines. No serious side effects were reported in the clinical trials. Some people had temporary reactions like sore arms, tiredness, or headaches for a day or two after receiving the vaccine. These temporary reactions were more common after the second dose of vaccine. Protection from the vaccine is not immediate. The first vaccines that will be available require 2 doses each, and it will take 1 to 2 weeks following the second dose to be considered fully vaccinated. This, plus the currently limited information about how well the vaccine works in the general population and how long protection from the vaccine lasts, means that even vaccinated persons should continue to follow the 3 Ws and all other current guidance to protect themselves and others. Studies found that the vaccines were safe and protective against COVID-19 illness in persons with underlying health conditions compared to persons without these chronic conditions. Because underlying health conditions can increase the risk for severe COVID-19 illness, it is important for individuals with chronic health conditions to get the COVID vaccine. The ingredients of the Pfizer Biantec vaccine are relatively simple. mRNA, those instructions for the cell, 4 lipids or fats to help protect the mRNA, plus some salts and sugar. The vaccine contains no preservatives. Anyone with a history of a severe allergic reaction, like anaphylaxis, to any ingredient of the COVID-19 vaccine or to a previous dose of the same COVID-19 vaccine should not receive it. However, those who have had severe allergic reactions to prior vaccines or other injectable medications can still get the Pfizer-BioNTech COVID-19 vaccine. And anyone with a history of anaphylaxis or other allergic reaction due to things like shellfish or other foods, latex, pollen, animal dander, or insect stings should get vaccinated without any special precautions. The decision to get a COVID vaccine is a personal choice, and we encourage people that have questions to talk to their primary care provider or seek information from scientific sources like the CDC. Remember that if you don't get immunized against COVID-19, you will remain at risk of illness and severe disease. The fairly minor side effects of the vaccine are nothing in comparison to the potential harm from COVID-19 illness. An end is in sight for this pandemic, so we must hang on and fight with all that we have until the vaccine is widely available and people step up once again, like they did against smallpox and polio, to protect themselves, their families and friends, and other fellow humans by getting vaccinated. Thank you. I'm now going to turn it over to Fletcher Tove, or Bill Hathaway, excuse me.
Thank you, Dr. Mullendore. Thank you, Ms. Saunders. I appreciate the opportunity to be here to share the perspective of what's happening in our health system and the perspective of what's happening in other health systems as we really approach an historic moment in our combat of the pandemic. Before I give the update about our capacity issues and other issues at the hospital and our plans for vaccine administration, I would like to take the opportunity to echo what both of the two prior speakers spoke about, specifically the need for continued diligence on the part of the community as we face the ongoing pandemic. We are certainly not out of the storm. While we see a light at the end of the tunnel, we are critically reliant upon each and every one of you in the community to help us by doing what is necessary to prevent spread of the virus as we move forward. And secondly, I would like to echo, and I'll elaborate on this in a little bit, what Dr. Mullendore said, I think, so eloquently and emphatically about the safety of the vaccine, the fact that we recognize it has been tested in an accelerated fashion, but a very safe fashion and proven to be efficacious. So if we look at what's happening at Mission Health, we certainly have seen a rise in cases, not just in the community, of course, but in subsequent hospitalizations across all the health systems in the region. Whereas we were previously hospitalizing about 30 to 40 patients in the late October, early November time period, we saw a somewhat unexpected rise in the number of hospitalizations preceding Thanksgiving. This preceded the gatherings, but was accelerated by the behaviors that took place at Thanksgiving. And our numbers in the hospital over the last week or so have averaged in the neighborhood of 80 to 85 hospitalizations. Again, our prior number was 40. That is a doubling in a month of the hospitalizations at Mission Hospital. Those in the intensive care unit, those numbers have also risen, previously averaging between 10 and 15, and now hovering in the 20 range. So while those numbers are certainly dramatically increased, they remain within our capacity and capability of taking care of patients in our health system. I've been in close contact with the clinical leaders of the other health systems in the region, including those at Advent Health, UNC Pardee, and the Duke LifePoint systems, in addition to the Cherokee Hospital, and they're also experiencing a significant rise in cases. Again, we've seen this across the state, and while we're able to handle this rise in the number of cases, we don't want to see the rise continue. It's critically important that we blunt the rise of cases as we approach the holiday season. And toward that end, I'm imploring everybody who's tuning in on this press conference to do exactly what Dr. Mullendore and Ms. Saunders asked for, which is practice the 3 Ws. While we recognize and we all appreciate and we share in the joy that the holiday season brings and the need to have family and camaraderie and closeness and love, and it's critically important that the most important gift that we give each other right now is the gift of health. And so we're asking that you wear a mask, that you wait 6 feet apart, that you wash your hands, and you really do what you can to limit the spread within your own homes. I think if we all behaved as if we personally had the illness, and if we behaved as if we were in a crowd where we knew the illness was circulating, in our own homes, if we behave that way in our private gatherings, we can come through the Christmas holiday in a good fashion, and we know that we can do this together. The next thing I'd like to talk about is really, I think, the most exciting thing that's happened in the last 10 months since the onset of the pandemic, the last year, if you go back to the onset of the illness in China, and that's the delivery of vaccine. We're happy to say that vaccine has arrived to Western North Carolina. There was a delivery of the Pfizer vaccine to the UNC Pardee Health System on Tuesday of this week, and Mission Health received its shipment of almost 3,000 doses of vaccine this morning. And we are actively engaging in distribution plans among our employees. I think most people are aware or should be aware that we have a tiering system for vaccine distribution. A tiering system is a fancy way of saying we're going to get the vaccine to the people who are at greatest risk and need it the most first, and then gradually distribute as we get more vaccine supply over time to the rest of the community. And so right now we are preparing to administer this initial 3,000 doses starting tomorrow, and then throughout, not just at Mission Hospital, but throughout the other Mission Health facilities in the region over the course of the next number of weeks and well into next year. We don't know how much vaccine we'll be getting on an ongoing basis. I think that's one of the great uncertainties of what's happening right now. We know there will be more vaccine. We just don't know how much and when. And we're optimistic that as we get that vaccine, we'll be able to take care of the entire community, working closely with our partners in the county health departments throughout the region. We know that, as has been stated by Dr. Mullendore, that the Moderna vaccine is expected to be approved this coming, actually today and this coming weekend, and we anticipate a shipment of an additional 1,300 doses of vaccine next week. So while that's a small amount in total, it is the beginning. It's the light at the end of the tunnel. And as we get more and more vaccine and learn about its safety, additional safety, we hope to get it to the community as soon as we can. So again, I'd just like to conclude again by thanking you all for what you've done, thanking the healthcare workers throughout the community who have really borne the brunt of caring for those with the illness and those caring in circumstances that have been dictated by the illness, even for those who don't have COVID-19. And I ask that all of you not only give the gift of health to your family members by practicing the 3 Ws, but that you also think about the healthcare workers and give them the gift of less of a burden in the hospital by minimizing the spread of the illness. Thanks very much.
Good afternoon. I'm Fletcher Tove, Buncombe County Public Health Emergency Preparedness Director. Next week, pending the Food and Drug Administration granting emergency use authorization, Buncombe County Public Health is expecting our first shipment of the Moderna COVID-19 vaccine. Locally, we are anticipating 700 doses, but this will be dependent upon the state's allocation and may change. If the vaccine arrives as anticipated, we plan to begin vaccinating on Tuesday, December 22nd and Wednesday, December 23rd. We will be following the state's prioritization framework laid out for Phase 1A of the vaccination plan. This means our first vaccinations will be going to our healthcare workers at the highest risk of exposure to COVID. Public health staff with high risk of exposure, county and city EMTs and paramedics, and staff who work our COVID testing sites and our COVID vaccination sites. These initial vaccinations will be dispensed at a closed point of distribution specifically for those groups that fall into Phase 1A. Our incident management team is hard at work planning for an efficient and equitable vaccination process. At this time, we do not know how many doses of the vaccine Buncombe County Public Health will be receiving in the following weeks. But as we receive more of the vaccine, we will expand vaccine distribution to a larger pool of healthcare workers at high risk, and also start taking the vaccine out to long-term care facilities for both staff and residents. We do not have a projected timeline for when we will go to Phase 1B or Phase 2, but we do know that it is the intent of the North Carolina Department of Health and Human Services to not move the state into Phase 1B of vaccine distribution until the entire state has completed Phase 1A. Vaccines are here, and it's a pivotal moment in our fight against COVID-19. But we have a long road ahead of us before we have enough people vaccinated to start changing our trends, and it will be even longer for those trends to change enough for the state to ease and start relaxing restrictions. It's as important as ever to follow public health guidance. To ensure compliance in our business community, the multi-agency COVID Enforcement Task Force is continuing to follow up on hundreds of complaints and reports of violations. So far, this task force has either observed or assessed over 60 local businesses and has observed a very high level of compliance across retail, restaurant, and gym industries. Overall, our business community is following state and local guidance to protect Buncombe County. Recently, there have been questions as to how hundreds of complaints have not translated into any citations being issued. So I wanted to take a moment to discuss the protocols of this task force, how we respond to reports, and also the nature of the complaints we are receiving. But first, I want to make clear that just because the task force has not issued citations, that we are still being successful in bringing businesses into compliance. There have been many instances where the task force has found a business in non-compliance upon arrival, provided education and materials, and brought them into willing compliance on site. The purpose of this task force is to ensure that local business community are educated and in compliance with the latest iterations of Governor Cooper's executive orders. When we assess a business for compliance, we are looking primarily to ensure that the business has met the following criteria: that they have posted their defined emergency maximum occupancy at each entrance, and that that occupancy limit is being complied with, that they have posted signage stating the requirement to wear face covering at all entrances, and that staff and employees are wearing face coverings, and that for locations with over 15,000 square feet of interior space, that they have assigned staff at all entrances to monitor capacity and to advise customers of face covering requirements. If we see a business is not in compliance with these requirements, we interact with management, educate them regarding the executive orders, and bring them into compliance at that time. If a business cannot or refuses to come into compliance, at that time, it would be grounds for a citation. And we have not seen that occur yet. We have seen 100% compliance with regards to face covering, capacity, and greeter requirements. We have not seen 100% compliance with signage requirements upon arrival, but we bring supplies with us and are able to resolve those issues on site, and have had 100% willingness and compliance with making those changes. There's also recently criticism that the task force is too focused on big box stores and not smaller businesses. The emphasis on first assessing big box stores was a specific tactical decision made in response to new language in Executive Order 180, subsection 1.8.4, which lays out the new requirement for any retail business with more than 15,000 square feet of interior space to assign a worker responsible for capacity and masking requirements to each entrance. Since this was a new provision that businesses had not been asked to comply with before, it was decided to first focus on education and ensuring compliance with this new requirement. And there are not many small, independent retail shops in Buncombe County that have more than 15,000 square feet of interior space. That is why the preponderance of the initial assessments conducted by the task force were for big box store locations. As far as how we treat complaints or reports of violations to the Ready team, any business that receives 3 or more complaints is forwarded to the North Carolina Department of Health and Human Services for documentation and follow-up, in which they send a formal letter to the business. Locally, those businesses will also receive a letter from the health director making them aware of the reports of noncompliance and urging them to review relevant guidance. Those businesses also go into the queue for assessment from the task force, and we are currently working our way through that list when the reports we receive are relevant and actionable. Which brings me to my last point, the nature of the complaints and reports that we are receiving. Of the roughly 400 reports the Ready team has received, about 94% concern face covering noncompliance. In Executive Order 181, subsection 2.4, there is a list of 10 exceptions for wearing a face covering for both workers and guests, including medical and behavioral concerns. And there's also a clause that states anyone declining to wear a face covering and citing any of those 10 reasons should not be required to produce any documentation or proof of that condition. This means that if a staff or patrons at a store are not wearing a face covering and using one of those exceptions, they are still in compliance with the executive orders as they are currently written. Individual business owners have the discretion of whether or not they allow those with an exception to enter their business premises. If they choose not to and ask that person to leave the premises and that person refuses, they can be charged with trespassing and other laws that they may be violating. If the owner chooses to allow these exceptions, they are still in compliance with the executive orders as written. I will say that we know that many people in several local businesses are using these exceptions to skirt around the executive orders and to flaunt public health guidance. They seem to think they are being clever, claiming a medical exception when none exists. But in reality, they are demonstrating a profound and tragic selfishness. This self-centered unwillingness to take a small action in order to protect our grandparents and our neighbors. Wearing masks reduces COVID transmission, and everyone should understand that is the goal of the face covering guidance. Our metrics are turning sour very fast, and the only tools we have to influence them before we have widespread immunization is by following the 3 W's. If we see the same surge in cases after Christmas that we have seen since Thanksgiving, public health will likely need to recommend enhanced restrictions in order to safeguard the capacity of our local healthcare systems. I encourage everyone to strongly consider the consequences of Christmas and New Year's get-togethers, not just to yourselves and your families, but the families of others and to the greater Buncombe community. Thank you, And as always, let's stay safe, let's stay smart, and let's take this step by step. I'll turn it back over to Stacie Saunders, our health director.
Thanks so much. We've heard a lot of information today. In closing, we want you to remember a few important things before we leave. Trends are not improving, but we can change this if we all follow the simple measures that reduce the spread. Further increase in trends could mean further restrictions, so please do your part to stop the spread. Celebrate the holidays with only your household and explore other ways to have fellowship with family and friends outside your house. If you absolutely must travel, even a short distance, for a gathering, get tested. Check out the Find My Testing Place website for locations. Follow the 3 W's at your gathering. It is so important, and it really does reduce your risk. Vaccine is in North Carolina, and more is expected very soon. This is a very hopeful and historic moment. We will not see widespread immunization efforts for several more weeks. So until then, wear a mask, wait 6 feet, wash your hands. It matters. And lastly, I found myself thinking about the song Have Yourself a Merry Little Christmas last night and how very meaningful it was right now. Someday soon, we will all be together if the fates allow. Until then, we'll have to muddle through somehow. So have yourself a merry little Christmas now. These are hard days, and we will muddle through as long as we work together, follow the measures that are in place as one Buncombe caring for each other. Happy holidays, and thank you for your time.
Okay, thank you for tuning in. We will continue to communicate regularly over the coming days and weeks to keep our community informed. For information on COVID-19 testing, and local metrics in Buncombe County, please visit buncombeready.org. Thank you and happy holidays.